Today, Kelowna will be opening its doors to a brand new psychedelic-assisted therapy clinic, the first in the Okanagan. Ketamine was first introduced in the 1970s and has been used as a fast-acting anesthetic in veterinarian and human surgeries for a number of years. While it has been known to carry the stigma of being a street drug, also known as Special K, doctors at this brand new ketamine suite are quick to break down those stereotypes.
Well, there is some stigma associated with ketamine because I think the layperson has their own ideas, or they've done some internet research, or they've heard negative things about ketamine. And of course, ketamine uncontrolled in the wrong hands and not under medical supervision does have a number of side effects and can have a lot of negative side effects, but that is not the use that we are using it for or recommending it for. The doses that we're using for our purposes under medical supervision are extremely low, very safe. The whole process is medically supervised. So those incidences of having things like bad trips or negative, significantly negative hallucinations or, those types of negative outcomes are really, really uncommon.
In the right setting, what psychedelics can do for a patient is that it can actually bring the negative emotions and thoughts to the surface where it can be properly dealt with. So it's like a catalyst to healing. It's not the silver bullet that's going to fix a problem, but it actually assists with that process. And oftentimes people can make more breakthroughs with one or two of these sessions than with 20 psychotherapy sessions.
I think with the addition of psychedelics, we've really had new and profound, exciting things happening in the field of psychiatry, which has not happened in years. The options available to most patients are not great. They don't have high success rates. And so this offers a totally different channel. And I think, definitely the onus is on our group, on psychiatry, et cetera, to inform patients so that they know what the options are and that these options are available. So the effects of ketamine actually are extremely quick. So within hours, people can feel an improvement. The onset of ketamine through an intramuscular injection is about 5 to 7 minutes. So the whole duration of the treatment for them is about an hour, hour and a half. They usually spend about 3 hours in the clinic when they're here. And then the rest of the day, they just kind of have an easy, nice day, and then they have their psychotherapy the next day. So in terms of things like acute suicidality, in terms of antidepressant effect, the onset is very quick. The problem with ketamine is that the duration is not that long, so the effect is not sustained unless you use that catalyst effect and then integrate it. If you just give someone ketamine and send them on their merry way, the effects, in studies show that it's under 4 weeks. So we want to prolong that, and that's why we're using all these other processes available to us.